Assalamualaikum warahmatullahi wabarakatuh. Hello, I'm Arlina Dewi from Universitas Muhammadiyah Yogyakarta. I will present my research with entitled Reducing Maternal Mortality, a qualitative study of health workers' exploitation in urban area Indonesia. My presentation will be divided into 4 parts. The first is the introduction or research background. The second is the method, followed by the result, and finally, the conclusion and recommendation. Maternal mortality remains a major challenge to health system worldwide. The global maternal mortality ratio, or MMR, dropped from 385 maternal deaths per 100,000 live births in 1990 to 216 in 2015. Is a 44% reduction. The Sustainable Development Goal target for the year of 2030 is to reduce the global maternal mortality rate into 70 per 100,000 live births and no country to exceed 2 times that ratio. Globally, it was found a few things that cause of maternal mortality. There were 73% of death caused by direct cause and 27.5% of death due to indirect cause. Postpartum hemorrhagic is the leading direct causes of maternal mortality worldwide. Apparently, it is not limited by the setting or geographic region among high-income countries. Diagnosis and treat before delivery. How about in Indonesia? The World Bank states that since 2000, MMR in Indonesia indicates a downward trend, but is upper than a 170 for 100,000 live births in year of 2017. When compared with several Asian countries, MMR in Indonesia is relatively still very high. The high MMR in Indonesia is not only from rural area, but also from urban area. Of course, this needs to be a concern for health services in urban area. Bantul is an urban area, but MMR in Bantul district are 108.36 per 100,000 live births in 2018. The number of maternal health facility in Bantul is quite complete, but the health facility as a comprehensive emergency obstetric care or PONEC referral hospital is only one. We know the ideally UNICEF standard is 2 for 1 million people. The majority of maternal deaths in urban area are due to direct causes, such as postpartum fever, bleeding, or toxemia. The study aims to explore the exploitation of health workers and stakeholders in maternal health services to reduce maternal mortality in urban area. The study is qualitative research. It aims to gather information from stakeholders regarding the high maternal mortality rate in the special region of Yogyakarta, especially Bantul district, through focus group discussion. Why Bantul? Bantul have 16 puskesmas with exponent and have 14 hospitals with 1 PONEC hospital. But Bantul is the highest maternal mortality in the special region of Yogyakarta, with 108.38 for 100,000 live births in 2019. Participants were taken by purposive sampling, including stakeholders at the health office or dinas kesehatan level, public health center or puskesmas, and hospital, private and government hospital, midwife coordination, puskesmas doctor, obstetrician, and nurse coordination. Total is 17 participation. FGD were only those who were willing and agreed to participate in the study. Data collection was carried out from FGD activities in one time. All FGD activities were recorded on video. Data analysis in the study used software NV4 Release 1.0 to utilize transcript encoding and categorizing. Accuracy of research on naturalistic approach is determined based on evaluation criteria: credibility, transferability, confirmability, and dependability. The ethical approval were obtained from the Health Research Ethics Committee of University Asia Yogyakarta. The result of the FGD show expectation that emerges from the perspective of health worker. This expectation arise related to the problem faced by health worker in the field, covering three major themes, namely the integrated system of collaboration between hospital and public health center or puskesmas, affordability, hospital comprehensive emergency obstetric care or PONEC action, skilled health worker and golden time opportunities for health worker. Maternal mortality is related to three delays, namely being delayed in decision making to seeking care, being delayed in finding an appropriate health facility, and being delayed in receiving adequate treatment at the health facility. Based on the result of the study, it provides a deeper maternal understanding of the expectation in the perspective of health worker, to improve the health of pregnant women to prevent delay for reaching PONEC hospital. Through a collaborative network of health workers between hospital and public health center, affordable referral hospital, and the availability of skilled health workers for the golden opportunity period. All of this can reduce maternal mortality. Conclusion: the expectation of health workers can improve the quality of health services in urban area, so that the reduction in maternal mortality can be pursued through an integrated system of collaboration between hospital and health center in monitoring pregnant women. The affordability of PONEC referral hospital in neonatal maternal emergency and the availability of personal skilled health stands by as a good time opportunity in handling obstetric emergency. Recommendation: health policy makers need to pay attention to the importance of integrated health services between the first level and the advanced level. For further research recommendation is to explore the perception of pregnant women and postpartum mothers about their needs and experience in access to health service in Bantul. Okay, thank you. Wassalamualaikum warahmatullahi wabarakatuh.